Thank you, Dom. I'm here today to talk about how crucial it is to use clear public health messaging to break political, economic, and social barriers to infection prevention. One of the biggest barriers to the goal of reducing infections, slowing viral evolution, and subsequently reducing chronic disease, disability, healthcare strain, economic blights, and premature deaths has been the confusing and often conflicting public messaging on how to use the tools effectively. As you've already heard, there is a scientific consensus that SARS-CoV-2 is spread in aerosols when we breathe and talk, and yet the actual public health policies have not been updated to align with this information. We also know that the dangers of COVID-19 move past those of acute infection and have for millions of people developed into serious, long-term, often chronic, and sometimes deadly effects of long COVID. Now that we understand, we need to get the appropriate public response and the political response. We need to acknowledge where our messaging has gone wrong, where it was politicized, back away from misinformation, anger, unwillingness, and confusion on the science, and put that to an end. That is what the clean air revolution is about. As we've seen today, the technologies exist, the impetus exists, and the science and research into COVID-19 transmission, control methods, and long-term effects exist. Yet having the tools is one thing, and getting people to use them effectively is another. This begins with clear public health messaging. There have been many models that have attempted to describe how to use multiple layers to prevent COVID-19. One that I think almost everyone is familiar with is the Swiss cheese model, in which using more layers of cheese or prevention strategies reduces the chances that COVID will break through their holes or weaknesses and lead to an infection. The problem is that when you're using, say, 2 or 3 of the wrong layers, the holes are not filled up and you can see right through. Let's take a step beyond this model and look into how these layers interact, honing in on masking. And when I say masks, I'm referring to respirator masks, such as N95s, their equivalents or better, ventilation filtration, social distance remote, testing, and vaccination. Communication is key here, so I'll suggest some examples of ways to answer important questions. The first piece of cheese that people often want to take out is masks. However, wearing a respirator mask in public spaces is important and prescribed in almost all public situations. Masks are a form of cleaning the air, a very effective form, considering it directly filters air as it's exhaled from a possible source, and again before you breathe it in, with a high level of filtration. When wouldn't it be prescribed? If you're remote or virtual, obviously you don't have to wear a respirator mask. Those who are under 2 have certain disabilities, those for whom it seriously interferes with breathing, or who are in medical situations in which they can't wear a respirator mask wouldn't need to wear a mask. Yet when you have individuals who cannot mask, it's even more important that those around them are wearing a respirator mask and that other layers are brought in as well. The more people who are masking in a space, the lower the risk of COVID-19 transmission. Second, some may wonder, is there a difference between one-way, two-way, and universal masking? Yes. Universal masking offers significantly more protection. This should be the standard. However, these spaces are harder to find right now, and we may sometimes have an essential service where we have to go into a one-way or two-way mask setting. If you find yourself in such a situation, you'll want to add as many layers as possible at the highest level as possible. For instance, you can improve your mask efficiency by finding one with a better fit or with a higher level of filtration, for example, elastomeric respirators or PAPRs. And you can ask for others, such as medical providers, to mask. How does ventilation and filtration factor in? On top of masking, extra ventilation and filtration to the 6 to 12 air changes per hour range is recommended for the purposes of infection control, leaning towards the higher end when higher numbers of people are present in the space. Remember that COVID-19 can build up and linger in indoor environments for hours, and ventilation and filtration take time to clear viruses out of the air. Masks give you protection during that space and time. Ventilation and filtration lower the density of infectious particles, making masks more effective. What about 6 feet? For one-way masking, personal space like 6 feet becomes even more important as viral density is stronger closer to the source. Spacing out provides the space and time necessary for ventilation and filtration to start to clear those infectious particles out. Note, 6 feet is not a magic number. Viral aerosols can and will travel beyond this distance, which is why wearing a mask is necessary even when spaced out. If personal space cannot be guaranteed, then it's even more important to add additional layers, for instance, testing. Different uses of tests. Adding screening tests can reduce the number of positive people coming into a space by catching some positive cases. However, because tests can miss and or delay picking up many cases, they cannot rule out an infection or contagiousness. Accuracy of tests is increased by using multiple tests, repeat testing, and PCR tests, but masking should not be removed unless a regimen is followed to have that person enter your bubble, which often requires significant isolation periods and multiple tests. What about vaccines? Vaccines are an additional layer to wearing a mask, not a substitution for. They're to reduce risks of severe disease during the acute infection. However, their effectiveness wanes over time. They don't prevent transmission or infection, and they do not prevent long COVID. Also, not all people are or can be vaccinated, and not all who get vaccinated are significantly protected. Thus, vaccines are not a substitute for other layers of prevention. In summary, it's important to not simply focus on using many layers, but instead pay attention to how these layers actually work. Find compatible layers to provide true risk reduction for you and others in the community. All are at risk for serious effects of COVID-19, and our actions affect those around us. Using clear messaging on what really works is the first step in overcoming obstacles to technological development, implementation, and policies, and bringing these tools into our home, work, school, and business spaces. Thank you.